everyone, welcome to part two of actually placing a rubber dam. And we have the lovely Nikki as our patient today. Say hi, Nikki. Hello. Our lovely contestant. Okay, so we've got all of our equipment laid out. What we want to do first of all is it's actually quite kind if, in this case we haven't given any local, but if you put a little bit of topical around beforehand. If the patient's obviously already numb, you won't need to do this. So I'm just placing a tiny wee bit of topical on the gum, just so that Nikki doesn't feel anything. Okay, so I'm going to isolate her lower six, which has got a giant MOD that needs treating. Just kidding, Nikki. All right, so I'm going to take my trusty little clamp that's got its little floss tied around it. I'm going to use my clamp forceps, or put-a-ronerers as I call them, and I'm going to place the clamp like so. So you don't want it to pinch Nikki's gum or she will squeal. How's that, Nikki? Does that feel comfortable for you?
Mm-hmm.
Excellent. You want to have these strands of floss so that they're sitting out on the outside in case the clamp goes ping, not that this will, or if there are any issues. The next step is to take our lovely rubber dam with the hole punched and to place it over the clamp. So the best way I find is if I use my 2 fingers and push it round and over the tooth. Sometimes it can be handy also, if you've got a flat plastic, you can just tuck the rubber dam in underneath. But once you've got it around the clamp, you can then get your frame and very gently seat it like so. Now it's really important to make sure Nikki can breathe, so we don't cover her nose with the rubber dam, and that it's not digging in anywhere on her face as well. It's really important. We have an isolated tooth, all done. I'm about to show you another way to put the rubber dam on, and that involves having the clamp already sitting in here. So this is sort of an extra for experts option. So what we do is we actually set the frame up with the rubber dam, and we have the clamp. You're an excellent patient there, Nikki. We actually set the clamp up so that it's in the rubber dam. Okay, so what we can do is we can have it sitting on the tray like that, ready to go. We pick it up with our little put-a-ronerer. We take it directly across to the patient's mouth and we place it on. That just saves a wee step, but it's not something that you have to do, and then adjust as required. All right, I think that's everything. Enjoy placing your rubber dam.